All right, so usually there's a little cap at the end of this that's got a one-way valve, so it's not open and exposed. Unfortunately, I don't have that now, but you can still use this the same way. So you drop your syringe, okay? Take your alcohol swab, and you're going to alcohol swab the top, okay? Generally, you should be alcohol swabbing for about 30 seconds, okay? However, realistically, most nurses will swab for about 5 seconds, okay? Once you're done swabbing, let it air dry, and then you're going to attach your syringe of normal saline. Sometimes the hospitals will purchase pre-filled syringes, which are nice because you just grab and go. Other times you'll actually have to fill your syringe yourself. So now that it's dry, I attach, screw it on. Now I'm going to unclamp. Again, 2 fingers on the short end, thumb on the long end to unclamp, okay? And then I'm going to do the turbulent flushing technique. Push, stop, okay? And what it's gonna do is it's gonna swirl the fluid around, so to hopefully get rid of any clots that are beginning to form. How many mils do I need to flush with? 3. At least 3 mils. What if I start to see a little bit of swelling? I'm not 100% sure if I'm seeing swelling.
Stop.
You can actually keep pushing to make sure, because it's just normal saline. What happens if normal saline goes in the tissues?
Absorbed.
It'll be absorbed, okay? I want to be 100% sure, because some people just have puffy wrists naturally, or puffy skin, okay? However, if there's complete resistance, I stop, or if I am 100% sure that I saw it swell up, I'm going to stop as well.
Or the patient will be uncomfortable.
Or if the patient's uncomfortable. It's normal for them to feel a little bit of a twinge, and it's quite normal for them to feel cold going up their arm, okay? Now, am I going to see swelling right here?
No.
Where do I see the swelling? At the end of the cannula. So you actually look a few centimeters down for swelling, okay? So push, stop, push, stop, push, stop. Minimum 3 mils. I'm not seeing any swelling. My patient's not reacting in pain or discomfort, and I'm not feeling any resistance. I'm confident that that is flushing well, okay? So what I'm going to do is disconnect, and we'd have the one-way stop valve, and then I'm going to reclamp. So again, 2 fingers on the short end, thumb on the long end, clamp, and we're good to go. That's what you will do every shift. Now, at the same time, I'm assessing the VIPS score, okay? I've got the VIPS score here. If at first glance it looks like a 3, am I gonna bother flushing? No, because if there's any infection in there, I don't wanna actually be pushing it further into the body. So you always assess and look the site before you start flushing and determine the VIPS from there, okay? So what VIPS score would you give this? 0, correct. So what I do is I write the date, the score, and initial under AM. And then the PM shift comes by and the night shift. Make sense? If I need to take it out, then I have to document when it was removed, date and time of removal, reason for removal, and then we actually are expected to monitor the site for the next 72 hours after removal. Because if an infection was developing, we want to make sure that the infection starts going away and it doesn't keep getting worse.
What about after 72 hours is after they don't have an infection but you just need to take it out?
So in that case, then you would do the exact same thing, date and time of removal, reason for removal, we write it's due. Okay, you still monitor for 48 hours or 72 hours after, just because there could have been an infection brewing that you haven't seen. And then you flip the page over, your RN will insert a new IV cannula, and you keep going. So you'll see that there's multiple sections.
Do you use the same arm if you're going to, so you've taken one out after 72 hours, do you use the same, obviously different area?
Really good question. You can use the same arm as long as you recite above, okay? So if I've had the cannula here, you cannot put a cannula down here, because if you put fluid, in theory, although I have seen people put cannulas below and it hasn't caused problems, but the theory is if you just took out a cannula from here and you insert one here and start putting fluid through, there's a little hole in the vein and you could start getting swelling of the tissues here, Okay, so general rule of thumb is if you're cannulating somebody, you start as low as possible so you can work your way up. And once you've worked your way up to the top, you start at the next arm, start at the bottom, work your way up. Okay?
So if you're going from there, the next point is here?
Yeah, if there's good veins,
Yeah.
because you want to make sure you can get it.
Yeah.
Right? Okay.
Mm.